This is the clavicle, and this flat end is the sternal end, and this more rounded end is called the acromial end. This is the body, and then as you can see, the inferior side has a protuberance called the conoid tubercle, and this is more towards the acromial end. So with knowing that this is the flat sternal end, and this is the acromial end with the tubercle, we can fit this up to know that this is the left clavicle, because this is the inferior side. Next we have the humerus. This is our anterior view. I'm actually going to flip it like this. Okay. This is our capitulum. And this is the trochlea. So the capitulum and the trochlea. And this is our medial epicondyle. Here is the medial supracondylar ridge. And then this is our radial fossa. We have our deltoid tuberosity. Kind of bumps out there. And we have the deltoid tuberosity is here. We have the head of the humerus. We have the greater trochanter and the lesser trochanter. Wow, wrong words. Greater tubercle and lesser tubercle. So the greater and lesser tubercle, and then the head of the humerus. Flipping it over, so this is the anterior side. Flipping it over, we have the trochlea, and then we have the medial epicondyle, and then we have the lateral epicondyle. We can know this because this goes into our socket. So then this is towards the medial. So this is medial epicondyle. This is the lateral epicondyle. This is our olecranian fossa on the back side, so on the posterior side, olecranian fossa. And again, we have our deltoid tuberosity. And then we have the surgical neck right here, where my thumbs are going around, surgical neck. And then we have the anatomical neck. And so this is the humerus. Anterior side and posterior side. Next we have the ulna and radius. Let's see if I can put this together right. Fits together like this. So let's take first this is the radius. So the ulna has that little hook thing, but this is the radius. We have the radial tuberosity right here, this big bump. And then this is the head of the radius. And then we have the styloid process of the radius. So only three things you have to know. That this is the head of the radius, the radial tuberosity, and the styloid process. But you can just see is that little piece that comes down more. So fitting them together again, Now this is our ulna. Like I said, it has this hook, which is called the trochlear notch. This is our ocranian. This is the coronoid process. So ocranian and coronoid process. This is our, when it fits together, right here is called the proximal radio-ulnar joint, because it's more towards our body. And this is called the distal radio-ulnar joint. This is the head of the ulna and the styloid process. So again, putting them together, the head on the radius and the head of the ulna are on different ends, but the styloid processes are both on the lateral or on the distal end. Now taking our humerus, we have an ocranian fossa right on this back side. So it fits right in there like a little socket. So that was our ulna and our radius.